And again, for the alders, if we could leave cameras on throughout the duration, that would help tremendously, not only for establishing quorum, but so I can recognize you if you want to speak.
You are live.
Excellent. Well, good evening, everyone. The hour of 7 o'clock having arrived on this 1st of March, 2022, in like a lamb, I will now call to order the City Council of the Common Council of the City of Racine. First item of business, Alder Tate, do we have any excused absences for this evening?
I've received no requests.
Okay, then moving on, we will move on to the Pledge of Allegiance. If people could please rise as you are able, face the east and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much for that, everyone. We'll now go to the next item on the agenda, which is the approval of the Journal of Council Proceedings, otherwise known as the minutes for the February 1st, 2022 meeting. President Tate, at this time, I would entertain a motion to approve said minutes.
Move to approve.
Motion to approve the minutes of the 1st of February 2022. Is there a second?
Second.
Seconded by Alder West. Thank you very much. Any discussion on the minutes for the 1st of February 2022? Seeing no discussion, all those in favor, if alders could all unmute themselves briefly, all those in favor of the minutes of the 1st of February 2022, please say aye.
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 Opposed? That motion carries. Excellent. We have a proclamation for this month, which I think is very important. It is in recognition of Women's History Month, and I will read the proclamation herein. Whereas each year Women's History Month offers an important opportunity for us to shine light on the extraordinary legacy of the American women who have built, shaped, and improved our nation. And whereas American women of every race, class, and ethnic background have been leaders not only in securing their own rights of suffrage and equal opportunity, but also in the abolitionist movement, the emancipation movement, the industrial labor movement, the civil rights movement, and other movements, especially the peace movement, which create a more fair and just society for all. And whereas this year's theme for Women's History Month, providing healing, promoting hope, is both a tribute to the ceaseless work of women caregivers and frontline workers who continue to bear disproportionate burdens due to the ongoing COVID-19 pandemic, as well as a recognition of the innumerable ways women of all cultures have provided both healing and hope throughout history. And where it is particularly important to celebrate women in healthcare, from vaccine researchers to public health officials to the countless heroines on the front lines who are working tirelessly to help defeat COVID-19, including the City of Racine Public Health Officer Dottie K. Bowersox and Community Health Nursing Director Bobby Fergus, who continue valiantly to serve our community in the face of a pandemic. And whereas the City of Racine has historically benefited from the contributions of countless more outstanding women leaders, including Maria Benedict Bauer, Reverend Olympia Brown, Thelma Orr, Dr. Beatrice Jones, Dr. Laurel Clark, just to name a few. Now there, I, Corey Mason, Mayor of the City of Racine, do hereby proclaim March 2022 Women's History Month, in witness whereof I have hereunto set my hand and caused the seal of the City of Racine to be affixed. Thank you, everyone, for taking part in that. We will now move on to the public comments portion of tonight's agenda. And I will ask the clerk to begin by first laying out the procedures for public comment and then beginning our commentators as they've arrived.
The public comment segment is an opportunity for citizens to speak directly to the Common Council. Speakers will limit their remarks to 3 minutes. There should be no dialogue or interaction between the speaker and elected officials or staff. This time is not intended to be a debate or discussion. The Common Council shall not hear personal complaints or attacks against any city employee or elected official or any matter related to an individual claim, citation, appeal, or lawsuit. Profane, disruptive, threatening, or conduct that otherwise impedes the safe, orderly, and effective conduct of the Common Council meeting is equally unacceptable during the public comment period as it is during all other portions of city meetings. When a group of people representing one viewpoint wishes to address the council, one person should be appointed the designated speaker for the group. Candidates for public office may not use this opportunity to campaign for office. Speakers during the public comment period shall follow all rules of the Common Council and rulings of the chair, including a decision to terminate the remarks if the speaker does not adhere to these rules. Public comment should be limited to ideas or concerns regarding the city of Racine. There will be one speaker this evening, Mercedes Ditson-Letta. Mercedes, can you go ahead? I believe you can unmute yourself at this point if you can. Mercedes, can you hear us?
Yes, I can.
Okay, and we can hear you. I'm going to go ahead and start your timer.
Okay. Gee, and I thought I was going to get to see you today in person, but I see it's changed when I read the console. I guess what's going to happen. So you're going to vote on the fact that you're going to be meeting in person in about 14 days. It'll be wonderful to see you again. If nothing else, it's certainly good for the citizens to be able to see you personally, you who represent us at all times, whether you're stuck away in front of a screen or not, but you make a lot of decisions. And of course, it's hard for you to get out and meet us unless you happen to have us call you. Because I noticed a lot of you didn't have your phone numbers when we look up the console. But anyway, I am so glad to see that we're going to be meeting in person. And that follows up with the fact of being able to have officially the masks ordinance to be lifted. That is at least your mandate for wearing masks. The fact that people have chosen when they are and aren't. So anyway, I'm glad to see that happening officially at the end of today. The next thing is I've been catching little glimpses about the fact the streets downtown are finally going to be changed from one-way to two-way. Exactly the timeline, I don't remember seeing that. And so the glimpses, especially those of us living down here or the businesses, it'd be good for us to know and hear what the timeline is and which streets, or is it all going to hit the street at one time. What I'd like to see is to make sure that it goes from stoplights to stop signs, especially on 6th Street, because people, the corners have the buildings so close. And just like the other day, trying to get across the intersection at Villa Street, it is really hard because people, once they're hit park, they just can't wait to keep going. So to have safety and to encourage the walkers downtown, make sure that we don't have to run all the time. It's not supposed to be a downtown for cars. It's a downtown for us. Like when Main Street had the possibility, or they had to have stop and go signs, all businesses increased their business up to 50% for some, with people saying, when did you open up? And they said 20 years ago. So it's about time we encourage the pedestrians to be downtown and those coming through it, stop and go to see what's there. See you next time. Bye-bye.
This concludes the public comment segment.
Thank you, Clerk Coolidge. We'll now go on to committee reports. And the first item before us, the first report before us is the Office of the Mayor report by Alder Tate, which will begin before we get to the items, President Tate, with a presentation regarding COVID-19 from our Public Health Administrator, Dottie K. Bowersox, and her team. Dottie K.
Yes, thank you and good evening. It's good to see all of you, and I'm here back talking about COVID as we have been for the last couple of years. Tonight, we're talking about the potential sunset of indoor face mask covering ordinance. So I have Bobby Fergus, who is our Deputy Health Officer, who is also the Division Director for Community Health. I have Cody Pierce, who is our epidemiologist. I have Stephen Curtis, who is their coordinator of laboratory services, and I have Sarah Clemens, who is the coordinator of the Division of Community Health. We have a short presentation, and then we're delighted to engage in any questions that you might have concerning the sunsetting of this ordinance. The ordinance language has been crafted by the city attorney's office, and I'm sure he will be delighted as well to have any conversation. At the same point, I'm going to turn this over to Cody Pierce to talk about the CDC recommendations that came off last week. He's also going to talk about what has happened since the beginning of the year with COVID and the number of COVID cases. And then also a little bit about our community level and where we're currently at in response to COVID-19. Okay.
Thanks, Dedicate. Good evening, everybody. So as Dedicate mentioned, we'll talk a little bit about where we're at now and the CDC's new community level guidelines that came out last Friday, the 25th of February. So with those new community level guidelines, they came up with a set of metrics to help guide both individual and household precautions, as well as community level strategies and actions that can be taking place to mitigate COVID in the community, prevent hospital systems from becoming overrun and other healthcare resources from being overrun as well. So some of those individual recommendations that would include masking at the high community level for everybody in indoor public places. Those who are immunocompromised consider masking or talking to their healthcare provider at a medium level, or especially at a high level, about the need for wearing a mask in indoor public places, as well as other regular actions they can take, such as testing. And then, of course, for everybody staying up to date with vaccinations, including a booster when you're eligible. Community actions that can be taking place, strategies include assessing the need for vaccination and testing throughout the community and taking actions to get those out to where they are needed. Increasing screening and testing in schools or other large places where feasible, and then preparing for patient surges in healthcare settings. So those are some of the things that would be recommended at the different levels based on the situation locally. So keeping in mind that, of course, masks still are required in certain places, such as when using mass public transportation, like buses, taxis, or on planes, and that those who either test positive, have symptoms of COVID, or who have been exposed should wear a mask for the required amount of time, depending on when their exposure happened or symptoms developed. So looking at where we are now, where we've been throughout this year. So it's been an interesting year for COVID, especially with the Omicron surge. We saw the highest number of cases and our highest case rate 2 months ago in January, back on the 9th. That was a case rate of nearly 1,800 cases per 100,000 individuals, which was a couple of times more than what we had seen previously. Currently, we are down to a case rate of about 58 cases per 100,000 people over a 7-day period, which is a tremendous, drop in cases, as you can see through the graph there. Just a look here. So a little more closely, just the month of February, you can see that we've continued to drop down to our current case rate there. So that case rate is one of the 3 indicators that goes into determining the community level at the CDC level. So that's the case rate per 100,000 individuals over a 7-day period. And the other indicators really relate to healthcare systems and how they are faring locally. So one of those is the new hospital admissions of those who are COVID positive over a 7-day period. Again, calculated for 100,000 people over that 7-day period. And then the third and final indicator that goes into the community level is the % of hospital beds that are occupied by those who are COVID positive. So you can see here, we don't have exact data for the city of Racine, but expanding out a little bit for Racine County as of last Friday, you can see that our new hospital admissions per 100,000 people were sitting at just under 16, and the % of beds occupied by those who are COVID positive was sitting at about 2.5%. So we take those 3 factors, our case rates, the new hospital admissions, and the % of beds occupied by those who are COVID positive, and we apply those to the CDC's community level guidelines to figure out where we are at. So you can see things there Basically, you would take the highest level that comes from those 3 factors. So currently, our interpretation of the CDC's community level guidelines based on the data that we have for the city of Racine would be that we are sitting at a medium level. So again, at that medium guidance level, universal indoor masking in public places is not recommended for everybody. Those who are immunocompromised or feel that they should wear a mask definitely should do so, but it's not a general universal recommendation at that level. This, of course, subject to change based on local factors. And these data are updated weekly at the CDC's website.
Thank you, Cody. We also wanted to give you some information or update you on our vaccination data. So we've got a comparison between the blue and the orange categories. The blue as of August 31st of 2021. Completed series for Wisconsin, 51.4, Racine County, 47.7, and the city of Racine, 41.1. When I take that and compare that as of February 24th of this year, of 2022, Wisconsin has increased to 60.3, Racine County has increased to 57.7, and the city of Racine has increased to 15.8. So again, those are within the completed series, a comparison between those timelines. We also like to note that only about 29.7 or about 30% of the individuals in Racine County have received the additional booster dose. So our numbers, our vaccination numbers are lower than the state of Wisconsin, lower than the county and currently. So at the same time with that, I need to do a shout out to Shannon Powell and to Vicki Selko. So both of those individuals have written grants. They have facilitated mobile clinics or pop-up clinics. They have facilitated community interactions, discussions, information to encourage individuals to get vaccinated against COVID-19. And they have done their job. If you can see, again, we've gone from the 41.1 to the 50.8. They've coordinated all that. We had the incentive program, and they've done an excellent job. And so we are just very, very thankful for what they've done and how they've done it. We appreciate it very much. Bobby?
So moving forward, the last 2 years have been very difficult, but we have definitely learned a lot of things. So moving forward through the pandemic, individuals will need to continue to incorporate the universal precautions that we've become accustomed to, such as hand hygiene, cough etiquette, and staying home when ill. Individuals will also need to remember that if they suspect that they have a COVID-19 infection, they should seek testing, stay home to prevent transmission to others, promptly notify their close contacts, and seek medical treatment if they are at higher risk for severe outcomes. We have ample testing throughout the community, along with vaccination sites. We have local pharmacies. We still have AMI's clinic, as well as the City of Racine Public Health Department continues vaccinations on Thursdays. Individuals may choose to wear a mask at any time. Individuals who are immune compromised or they need to protect someone in their family that may choose to wear a mask. Following these guidelines and remembering the different resources that we have in our community will help us move forward in the pandemic and help us stay healthy.
No, thank you, Bobby. So this is the end of this latest surge. I think it was number 5. But this is not the end of the pandemic. So as people have said and I've heard repeatedly, we may be done with COVID-19, but COVID-19 is not done with us. At the same point, we've been through our processes here. We've been able to protect our finite systems. Our hospital healthcare systems did not have to triage in a parking lot. Our fire department, police department did not have to call for out of jurisdiction support. Our health department, we made it through this so far. We've been doing well. At the same point, it's the responsibility of every individual to stay safe and be respectful of the needs of other individuals. And if at all possible, to get vaccinated. We've said we followed the science, we've followed what the CDC recommendations have been, and that's why we're here this evening requesting a sunset on the face mask ordinance for the city of Racine. And we'd be delighted to entertain any questions that you might have.
Thank you very much, Dottie K. Before we go to questions, I first want to offer a note of gratitude and thanks to you and to Cody and to Bobby and your whole team that are really going on 2 years here of extraordinary service to our community through the worst pandemic in a century. So thank you, thank you, thank you for all of your hard work and dedication to our community and to people's health. Why don't we start with Alder Miedema, who has a question.
Thank you, Your Honor. I appreciate a couple minutes here, and just want to echo the mayor's words. Sadike, to you and your team and to everybody who's been connected in some way, I can't thank you enough and commend you for the incredible work that you have done to this point. It has not been easy. It has not been something that I think most people would have chosen to do, given the choice, but you all stood up and took it on and did it with poise and did it with professionalism. And I am just impressed by each and every one of you every day. So thank you for everything that you've done to get us to this point, and hopefully it'll only get easier from here. A couple of quick questions I would like to ask. I know looking at the numbers, and seeing the decline, which is great news and certainly the direction we want to go. And you may not honestly have answers to either of these questions, and that's totally okay, but I kind of want to ask just in case. Is there any sense of the decline being that people stopped reporting, have backed off on seeking help if they are showing symptoms, and have just kind of taken the mentality of, I'm just going to deal with it on my own and move on? Or do we really know that there is a significant decline because we are getting through the worst of this?
Yeah, thank you, Mayor, and thank you, Alder. That's an excellent question. So we have bantered that around for weeks now. And part of it is that the home test kits are now available, and those are not reportable to any local public health department. And the number of individuals who are getting tested have also decreased significantly. At the same time, if we take a look at the hospitalizations that Cody mentioned just a few minutes ago, we're seeing that surge where we were seeing that 6 to 15 hour wait time in emergency rooms, individuals being in the hallway and in laundry rooms where they're being facilitated because the hospitals are so overrun. We're not seeing that right now. So I think truly we have a decline in the number of COVID positive cases. But as far as the actual community transmission, we don't have a good sense on that because, again, we've got a lot of these home test kits. And people don't want to get tested. So, they want to ride it out, as you mentioned, and they don't want to necessarily have interaction with public health department and or physician's office.
Thank you. Yeah.
Do you have another question?
Yeah, just one more quick question. I appreciate that. No, thank you for that answer. And I think maybe something we all suspected a bit, but obviously the decline in hospitalization is a good sign. So thank you so much. And my second question, and I think the sunset is really good news for local business. And, obviously I think they're probably a majority excited for this as they look to kind of get back to normal in whatever sense. Again, this question may not be something you're really tracking closely or at all. Do we have any sense of how this mandate impacted local business and their ability to perform locally? Do we have any sense of what impact sunsetting this will have on? I'm sure we can't really predict performance, but just any feedback on that component of this that you might have.
Oh, and thank you, Alder. No, I don't. We haven't kept track of either one of those as far as the effect and or the sunsetting of this would potentially have on businesses. Excellent question.
I can just say anecdotally, I've certainly heard from several businesses who are enthusiastic about the possibility of a mask sunset. Whether or not that leads to changes in their bottom line or productivity or number of customers, it would be hard to quantify.
Thank you, everybody.
Thank you, Jason, for your thoughtful question. I'm sorry, Alder Miedema, for your thoughtful questions. Daddy can you talk a little bit about where we are with deaths as a result of COVID? Are those also seeing a decline that would match the infection rate and the hospitalization rate?
Yeah, Mayor, so I can answer that question for you. So yes, death reports have definitely slowed down. We were getting several deaths reported to us daily, much more than we had seen previously. That was back in mid to late January when we were seeing that surge. Now we have definitely seen a slowdown. So that kind of matches this trend we're seeing in cases and hospitalizations.
Thank you very much. Alder Perez.
Thank you, Your Honor. I appreciate you putting forward this sunset of the face coverings. Reading the internal memos that we got on this and looking at it on here, there's no mention of it for employees. What is the relationship of this to our employees? And if it's not at the same time tonight at midnight, why not? Can you explain that to us, please?
Sure. So that's a separate personnel issue that's not noticed here tonight. Certainly, the personnel policies are things that we're reviewing internally and discussing with administrative managers, but that is not part of the mask ordinance per se this evening.
Thank
Did
you.
you have? Thank you. Alder Taft.
Thank you. And again, to reiterate what other folks have said, I'm just in awe of what the Public Health Department has been able to accomplish. And I am just grateful and thankful for all of your hard work and expertise. I do have a question about, according to the data that you all have, that right now we are in the medium category. How long have we been in the medium category given the numbers that you have? The new medium category, right? Like the new medium category is new, but given the numbers we have, how long have we been in this new category, if you know what I mean?
Yeah, good question. So I don't have an exact figure on that for you, but certainly probably only since, maybe earlier this month or February, now that it's March, since we were having a pretty big peak in hospitalizations, and that's a big factor that leads into this. So probably for only maybe a couple of weeks.
Yeah, I'd say 2 to 3.
Okay. My other, can I follow up? Is that okay?
Yeah, please, Alder Taft, continue.
The other question I had is, one of my concerns regarding the mask mandates, we know that the science behind masks, we know that surgical masks and N95 masks, they work. We know that that's just fact. It reduces transmission. It keeps people safe. One of my concerns is that the school district is following our example and has said that they're going to make masks optional as well. And I'm concerned about the data that came out today that the vaccine is less effective in children ages 5 to 12. And as we know, children under 5 haven't been able to be vaccinated at all yet. So I'm interested in your thoughts about the data that came out about the children between 5 and 12 having the vaccine. I know it prevented some hospitalization, but it doesn't seem to be preventing transmission that much. So I would appreciate your thoughts on that, because I've heard from a number of teachers, and I certainly have children in public school in RUSD. So I'm interested in your thoughts.
Oh, thank you. Who was that, Robbie? Okay. Oh, thank you, Alder Taft. We appreciate the question. So, and you are correct. As far as the efficiency, shall I say, within the vaccination for the younger children and such, at the same time, the vaccine wasn't a 100% for children or for adults. So, as we've talked, that it's never been 100%. Was to reduce the symptoms and the potential for being hospitalized. Again, we're looking at those finite systems. That's what the vaccine was meant to do. And it still does that. And yet at the same point with the younger children, I anticipate at some point there'll probably be some revisions to that, since this came out of the clinical trials and went into the public. So I think there'll probably be at some point some revisions and potentially the increase in that amount of vaccine. But again, it was to be anticipated, since it's not 100%, but it was helped to reduce those symptoms and reduce hospitalizations. As far as the schools go, yes, I would anticipate that they will follow suit, and they will make masks either mandatory or not require masks at all. It's been a difficult encounter, I think, for everyone within every community and within the schools to try to maintain the mask, decide if there's medical exemptions for the mask, what kind of mask to wear. And so at this time, again, each parent will have to be responsible, each school will have to be responsible to make a decision for their family if they would like their child to be masked or unmasked. And you are correct, the surgical masks, the N95s, K95s, are excellent tools to protect oneself and to protect those individuals that you're interacting with. And I'm hoping that many parents will decide to continue with the mask, as well as many businesses will ask their employees to continue with the mask. Services are essential. We don't want to see closing of grocery stores or pharmacies, and we don't want any more closing of the schools. So it's really essential in those points that Bobby brought up. If you're sick, you stay home. If you got a cough or cold, in your sleeve. If you aren't feeling well, if you are immunocompromised, masks are most appropriate.
I appreciate that. Just to be clear, so I mean, the science is pretty unequivocal that masks reduce transmission. It's a pretty simple way that we a tool in our arsenal to prevent this. At 58, I think the number 58 per 100,000 sounds low to people, but it's relatively high transmission. And is your personal recommendation, if a person at 58 per 100,000, that people do, continue to wear masks indoors? I mean, that's what most of the epidemiologists I've been reading say. Like, should people wear masks indoors?
Yeah.
And I guess just to ask it another way, Dottie K, will you continue to wear your mask indoors moving forward?
Yes, it's very simple. Yes, I will continue to. So, and especially, as Alder Perez had mentioned, it's a personnel issue that has yet to be decided. But if I take a look at my clinic, for example, the rooms are very small. We do examinations. We're right there. The clients are right there. We're right there. And so, yes, I will continue to wear a mask, and my staff will continue to wear a mask. So, at the same time, we said that we would follow CDC guidance and guidelines, and we have along through this entire pandemic, and we did the last time when the CDC recommended that masks be lifted. So this environment, we've said this before, the only thing consistent about COVID is its inconsistencies. And the unpredictability of what's going to happen in 2 months or 3 months or whatever tomorrow, and what those recommendations will look like. But for this evening, as we're asking for the sunsetting of the ordinance, we are following CDC guidelines, which puts us in the medium category. And that's the best that I can say for that. We've done it before, and that's what the recommendation is this evening.
Okay, thank you. Alder Taft, did you have another question?
I just wanted to make a comment. I don't want to belabor the point, but I guess, I'm enthusiastic in support of following the science. I would like to follow the science a little bit longer than 2 weeks. So I think that these trends are great and they're encouraging. And but based on the fact that, nobody under 5 is eligible for vaccination, and that the fact that transmission in our community is still high, and based on the fact that I would have liked to bring this forward maybe in a couple more weeks, because we said originally we were going to try and do 3 weeks. I'd like to see 3 weeks in a month. Let's see if the trends hold before we lift the mask mandate. So I'm not opposed to lifting them ever, but I'd like to see a little more time. So I just wanted to put out there, I will likely be voting no, just because such a vulnerable population, under 5s, can't be vaccinated. We have to, I see my job in this, I see my role here as helping to try to protect the most vulnerable in our community, and as does everybody else. And I would just be comfortable with it, like seeing a couple more weeks of in the medium to, hopefully low category. So that's just where I'm standing, but I appreciate all of the work, and I think this is encouraging.
Thank you, Alder Taft. And just to be clear, whatever action here we take tonight does not prohibit a school or a church or an organization or a business to have its own policy on mask wearing if they so choose to continue to do so. So we're no longer saying it's mandatory in indoor settings, but there's, again, no prohibition if there are organizations that want to do that themselves. Any further discussion on Dottie K's recommendation here? And so I guess, Dottie K, before we move on to, because there's 2 recommendations before us this evening, did you or your team want to comment on the phasing the meetings in person back in over the next month or so?
Yeah, oh, thank you, Mayor. Yes, we're comfortable with those recommendations as they're written and as they're proposed this evening.
Okay, thank you very much. Any other questions for Dottie K or Bobby or Cody or their whole team that has just done amazing work for us? I see no other hands. Seeing no further hands, I will go then back to the mayor's report and ask President Tate to read the first item.
Item 0124-22, direct communication sponsored by Mayor Mason, adopting ordinance 0001-22, sunsetting of face coverings. Move to approve.
Second. Alderman
So
McCarthy.
motion to approve item 124-22 from President Tate. It is seconded by Alder McCarthy. Discussion. Alder Coe, are you trying to raise your hand?
No.
Okay. Any discussion on this matter? Okay. When the clerk calls your name, again, this is item 124-22. This is a communication sponsored by myself adopting ordinance 1-22, sunsetting the face covering ordinance. When the clerk calls your name, please vote as you wish.
Alder McCarthy,
Aye.
Alder Coe,
Aye.
Alder Jones, Alder Jones, thank you. Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Caprillion,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder West,
Aye.
Alder Pete,
Aye.
Alder Rouse, Alder Rouse, Alder Perez,
Aye.
Alder Taft,
No.
Alder Mikma,
Aye.
Alder Lemke.
Aye.
That's 13 ayes, 1 no, and 1 absent.
Okay, that motion passed. Alder Tate II, would you read the next item, please?
Item 0126-22, communication from Mayor Mason proposing that resolution 0645-21 and 0864-21 be amended to allow City of Racine governmental bodies to return to in-person meetings and be rescinded in its entirety on April 20th, 2022. Move to approve.
Second.
The motion to approve item 0126-22 by President Tate. It is seconded by Alder McCarthy. Any discussion on this item? Alder Coe, did you want to speak?
Yes, I just wanted to ask, sometimes we can't make these. Is there going to be any opportunities to be able to do these virtually if we can't make the meetings or no?
So what we have currently, Alder Coe, is an exception for people to operate virtually if they have a certain set of requirements, be they sick or on medical leave or military leave. But this does not propose doing a hybrid model where some would be here and some wouldn't unless there's an extraordinary circumstance. If that's something you want to discuss, we'd have to discuss that at a future time.
Okay, that's all. Thank you.
Well, thank you. Any other discussion? Seeing no further discussion, this is again item 126-22, communication for myself proposing resolution 0645-21 and 0864-21 be amended to allow City of Racine governmental bodies to return to in-person meetings and be rescinded effective April 20th, 2022. When the clerk calls your name, please vote as you wish.
Alder McCarthy,
Aye.
Alder Coe,
Aye.
Alder Jones,
Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Caprillion,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder West,
Aye.
Alder Pete,
Aye.
Alder Rouse,
Aye.
Alder Perez,
Aye.
Alder Taft,
Aye.
Alder Mikma,
Aye.
Alder Lemke.
Aye.
That's 15 ayes, 0 noes.
That motion carries. We'll now move on to the Finance and Personnel Committee report by Alder Taft. Alder Taft, do you have items for separate consideration?
As a matter of fact, I do. I have 3 such items. One of them does not require going into closed session and the other 2 do. So I guess I would humbly suggest at the discretion of the chair to do separate consideration for 111 first, but I'm happy to do however you want to do it.
Nope, that makes sense. Please proceed as you suggested.
Okay, so we're going to read item 111-22, or we are, if I can open. Okay, communication sponsored by Mayor. So this is item 111-22, communication sponsored by Mayor Mason requesting the city transfer 233 Jones Street, 1801 Mead Street, 1805 Mead Street, 1422 Marquette Street, 1317 Albert Street, and 1637 Packard Avenue to the City of Racine Community Development Authority for the purpose of redevelopment and sale to homeowners. Recommendation is that these transfers be approved. Fiscal note, transfer of each property will require $30 in recording fees, totaling $180 in transfer fees total. And I would move to approve.
Second.
There's a motion to approve item 111-22 by Alder Taft, seconded by President Tate. Any discussion on the matter? Alder Perez.
Thank you, Your Honor. I have a couple questions and then I'd like an opportunity to vote on it. I was looking at the memorandum and it states that there is the development of CDA properties instead of city-owned properties limits the liability of the city of insurance claims, subsurface discoveries, or other unexpected events should occur during the development process. Can you take a brief moment, or someone take a brief moment and explain how the CDC is not part of the city, or what the relationship is between the two so that we can understand it a little better?
Sure. I mean, and this was statutorily exactly what community development authorities were set up to do, but I will ask Mr. Regic, who I believe is on, and or Mr. Letney to sort of explain the function of a community development authority. Again, it's a statutorily authorized process. It's not unique to Racine, but it's a good question that Alder Perez is asking in terms of understanding the relationship between the two. I will first defer to Mr. Regic if he is available. Matt, are you there?
Yep. Thanks, Mayor. Alder Perez, this is, as the mayor mentioned, one of the responsibilities that the Community Development Authority and in the past, the Redevelopment Authority, the city of Racine have played with regards to city properties, sort of acting as something of a liability shield for situations exactly like mentioned in the agenda briefing memo, be they ownership of contaminated properties or materials, or other, possible insurance claims, things of that nature. And I would defer to the city attorney on this, but the CDA is a separate body politic from the city of Racine and is a separate organization entirely. But is organized by the city of Racine, and in that way, has its own mission and goals, but is still, in this case, funded by and directed by the city of Racine. So I would defer to the city attorney to sort of go into some of the differences between what that relationship is and how that plays out on the ground.
Yeah, and I will ask Attorney Letney, understanding that we didn't ask him to prepare for this ahead of time, but nonetheless, Attorney Letney, are there any comments you'd like to add to extend Mr. Regic's description of the authority of the Community Development Authority?
Sure. So the alders may recall that the city used to have a redevelopment authority. And 2 years ago, I think actually at the end of 2019, the council dissolved the redevelopment authority and stepped up a community development authority. Community development authorities have the same powers as a redevelopment authority and a housing authority combined. So statutorily, as Mr. Reddick says, a community development authority is a separate body politic. That means it's its own entity, separate from the city of Racine, created by the city of Racine, but separate from the city of Racine. Almost think of it as essentially a separate corporation that's owned by the city, to handle all the kinds of things that a redevelopment authority could do, blight remediation, housing issues, kind of at the direction of the council based upon some broad directives, but independently.
Alder Perez, did that answer your question, or did you have any follow-up questions to that?
Yeah, I have some follow-up questions. That's that's what I thought. I just wanted to make sure we all understood it that way, having been on the redevelopment authority before. So we have internally received some complaints about using this money to buy properties that we will sell or redevelop at a much higher cost than we will sell the property once it's being built. Is this wise at this point to go ahead and buy these properties, understanding that there still may be some complaints in the works or some litigation possibly coming up into the use of the money that we received to be able to do this?
Well, just to clarify, Alder Perez, it's not the money authorizing the expenditure to build the houses was a separate item that the council made earlier. This is really a transfer of land from the city to the CDA. So that's not what's being voted on here tonight, although it certainly is in the context of it. But I just wanted to clarify that as you raise that concern. Mr. Reddick, did you want to try to address Mr. or Alder Perez's question in context of just the financial realities of land banking in certain parts of the community?
Sure. Thank you, Mayor, and thank you, Alder Perez. And unfortunately, that is really the reality that we have to face when we're, looking at redeveloping currently vacant residential lots in the city of Racine. The economics don't necessarily, pencil out, and in many cases, we're forced to really, to take an economic loss on the redevelopment of these properties by building housing on the lots and selling them to homeowners. But we, really feel that this is, it's a worthwhile investment in the cause of creation of homeownership in many of these neighborhoods that in which these properties exist. And, even if the economics do not necessarily, provide the returns that a private sector entity would be looking for to be able to generate a profit, we still see social return on this as well. And that's really largely what I think the intent of the investment is for, to be able to prove a land banking model and to generate some early wins with regards to creation of homeownership opportunities and transfer of the homes to new homeowners in the community to bolster our homeownership base in the city.
Yeah, thank you. So would it also make sense to buy distressed properties as they are and rebuild them without having to completely get the property and then build something new on it that would cost so much more money?
I think you're asking a good policy question. I'll allow it, but it's a bit of field of what we got here. But Matt, do you want to try to answer the challenges of restoration and redevelopment in the city?
Sure. And Alder Perez, I think it is a both and question. I mean, we've really got two, separate policy decisions ahead of us and two different solutions that need to be had. By embarking sort of on this path with regards to the creation of the construction of housing on vacant lots, this is a solution that we're looking at to strategically invest in vacant lots in select neighborhoods where the lots are already owned by the city of Racine and there's no acquisition costs. But staff is continuing to research and to look into ways that funds could also be used for the acquisition of existing properties to be able to perform rehabs as well. So I think there are certainly opportunities to reinvest in homes that currently exist, as well as build new homes on vacant lots that also need solutions in the neighborhood as well. So I really think it's it's two daunting tasks, but they're two tasks that require separate solutions.
Alder Perez?
Yeah. So I've having been on the redevelopment committee before, I've also seen it as a worthwhile venture for our city as we continue to develop and provide housing in our community. I just want to thank Matt for his diligence and his work in his department in doing this. I will be voting no, because I still think that we can do this better than the way we're currently doing it. It seems to me like we're wasting money. And I know that there's a policy issue involved and there's probabilities that it wouldn't be any cheaper, but it on its face, it just looks like we're losing too much money for what we want to accomplish. And even though I know we want to get rid of some of the blight and we want to develop some good home ownership opportunities, it just doesn't seem like a good cost venture for us. Thank you.
Thank you, Alder Perez. Alder Coe. Alder Coe, you're muted. I look forward to a council where I don't have to say that. Alder Coe.
I just want to say, I'm glad to see this moving forward again. Years ago, we had neighborhood housing services that built a lot of houses in these blighted areas. Other people fixed up their homes. And yes, these homes were more expensive. And I had people tell us our neighborhoods aren't worth this type of money. But the investment put in by us upgraded the whole neighborhood. People started working on their houses. Neighborhoods were improved. I had a house that was going to be torn down. We saved it on Grand Avenue, and we got a nice home out of it for homeowners. I think this is the way we need to move, and we need to do this a lot more. And I want to thank you guys for moving forward on this.
Thank you, Alder Coe. Alder Pete.
Thank you, Mr. Mayor. I'll start with my first question. And going back to the statutory liability issue, is all the city's liability, or maybe all is not a good term, but is the city's liability limited when it goes to the CDA?
It is. That is part of the function set up under statute for community development authorities to perform. Again, I'll defer the question further, however, to Attorney Letney, just again to revise or extend those remarks in case I erred or omitted anything critical.
No, I think you've described it well. It's very much like one company setting up a separate limited liability company or corporation to set up a liability shield between the two entities.
Thank you very much. Just a comment, I think it's a great idea if done in an economically responsible way, because it adds, as someone mentioned, might have been Attorney Lidney, that there is a social cost involved in it. It pulls up the whole neighborhood. And I think it can be, if done in the best manner, a win-win situation for the whole city. Thank you.
Thank you, Alder Pete. President Tate.
Thank you, Mr. Mayor. I was going to speak in support of this, one, because we've already allocated the funds to the CDA to do this. But two, as we get a little bit far afield from the actual discussion about transferring the properties, the end game here is to improve neighborhoods. I don't think anybody in this committee or commission or body lives next to a vacant lot in their neighborhood. So you might not know what it's like for those who currently do to have to look next door, such as my constituent on Jones Avenue, who's constantly saying, like, what's this tall grass growing during the summer? Because that's what happens on vacant lots, particularly in these portions of the city. And unless we build on these properties, and unless we build on these properties as a city, because the reality is it's not cost effective for a private entity to build a new property and then sell it in these areas. And it's not our job as a city to be a business in the mode of making profit. Our job is to improve the lives of our neighborhoods and our neighbors. And in doing so, we might take a loss sometimes, but we take a gain in pride in a neighborhood, in satisfaction with where you live, in removing blight. So if we sell these at a loss, we're selling them at a win in another regard. So I think some folks might get wrapped up in, well, $300,000 to build a home and you're going to sell it for, 2/3 of that. And so what? Whoever buys those is probably going to be a first-time homeowner, probably a younger person purchasing that home, and they're going to be in this community for a lot longer than an older person who's going to be purchasing those homes as well. So everything about this, as far as what it looks like in action, is a benefit to the city and our community as a whole. So I'm certainly in support of this. And I did see one comment out there that was pushing back against this, saying like, so you're building homes in the hood. And I take offense, not because they're calling certain neighborhoods the hood, but as though we shouldn't be investing in the hood. Like, what are we doing here? We should be building homes everywhere in this city because everybody and everyone has a right to live in a place where they can be happy and safe and sustainable. And this is just another one of those opportunities that we have as a city to go forward and put our money where our mouth is and put our values where our money is. So I'm happy to support this. And again, this is really just a formality in terms of transferring the properties, but hopefully we can do a lot more of this, including rehabilitating homes that aren't to the point where we've knocked them down and they've been a vacant lot for 20 years. Thank you.
Thank you, Alder Tate II. Alder Mi'kmaq.
Thank you, Mayor. I appreciate that. And just, I don't know if I'm feeling feisty because my time as an alderman is coming to a close here in the next month and a half, but I'm feeling a little bit disappointed that we are having a conversation of not supporting something of this. We are looking at ways to continue to be more equitable as a city and as a council. And this is directly in the vein of an equitable approach to building up our community and to continue to lend credence to the threats of people that don't have the best interest of their neighbors or the community in mind and feel like they can bully their way by throwing things around. We're seeing that around the country, around the state, and then we're going to lend credence to it here in this body is highly disappointing and discredits the work that people are doing both within the city development and to backhandedly say, well, I think this is good work that you're all doing, but I'm not going to support it because I think you could probably do it better is mind-boggling to me. It don't compliment on one hand and then turn around and act like it could be done better as if they're not smart enough to be finding the best way to be doing this. I really am frustrated because the comments like comments that are giving people power when they're using a bully approach is inexcusable. And we should not be bending to the will of that. We should not be taking apart our efforts to be equitable. And by giving credence to those kinds of comments is why we continue to live in a society and in a community where these systemic issues dominate and continue to push down people in parts of our community that struggle every day. And I am wholly supportive of this, and every single time something like this comes up, I am hopeful that the majority of this body will continue to support it because this is what we are trying to do to make our community a better place. And I appreciate you all giving me the time to speak. Thank you.
Thank you, Alder Mi'kmaq. Alder Jones.
Thank you, Your Honor. Just wanted to say I am fully supporting the building of these homes. As Alder Tate stated, they will uplift our community, and we are trying to attract people to the city of Racine. And no one really wants to buy a home or move into an area where there are a lot of vacant lots. And this will help attract new homeowners to the areas. And I was also offended by that comment, living in the hood. Just on a personal note, I'm only 3 blocks from where one of those homes are designated to be built. So I just didn't appreciate that comment. But I hope everyone supports this. We have had buying homes in the city of Racine for, I'm sure, over 30 years doing it this way. Because we once used to have a program where a person was able to buy a house for $1 if they were able to fix it up. And I know some of the people that did purchase those homes, they lived in them for 10, 20, 30 years. So I am in support of this. Thank you.
Thank you, Alder Jones. Alder McCarthy.
Thank you, Mr. Mayor. I fully support the policy we have in place, as well as this particular transfer of land, but I also fully support Alderman Perez's right to question the particular transfer and perhaps the policy in another format as well. I don't believe clandestinely challenging other aldermen is really the way to approach this at this point. It's as much bullying as any other thing we said earlier on, as brought up by Alderman Miedema. So I'd just like to say, on the item, all for it. Let's just take a deep breath, everybody.
President Tate, your hand is still up. Did you want to speak again, or is that
Yes,
from
I
before?
just had a quick question for Mr. Regic. Thank you, Mr. Mayor.
Yes.
And this may be slightly deviating because it's more along the fiscal lines of the item, but I did want it to be clarified for those who might be watching and those who may have seen an article about this particular process in the newspaper. That the question is, when the home is purchased, what happens to those funds then? And then what is the next step with those funds?
Again, we're getting a little far afield from it, but it is somewhat germane to the topic before us. Mr. Regic, could you clarify how these funds get reinvested into the CDA for future projects?
Sure. Thank you, Mayor. Thank you, President Tate. Those funds, because they are federal in nature, because they are related to the American Rescue Plan Act, those funds are returned. The proceeds of the sale are returned to the city, the Community Development Authority, for future reinvestment in eligible activities and presumably, future land bank activities as well.
Thank you. And the reason I want to clarify that is because I want folks to understand this isn't a one-off sort of thing, but the funds that we expend, even though we won't get 100% of them back, are going to continue to recycle back into similar projects, whether that's, rehabilitating homes or building brand new ones on vacant lots. And that will remain to be seen for this Community Development Authority, as well as for the Community Block Grant Authority to decide what happens with those funds at that time. But I just want to be very clear that once this happens and these are built and purchased, then those funds get to, find a new life in another home and continue to improve neighborhoods. So it doesn't stop. And it's also not brand new. We've actually done these types of projects, I don't want to say for time immemorial, but plenty over the last few years. It's just fortunate the American Rescue Plan funds also allow us to do similar and expand those efforts. Thank you.
Thank you, President Tate. Alder Rouse.
Thank you, Mayor Mason. So you guys can hear me?
Yes.
Sorry, I was having difficulties earlier. Do we have any estimates on what a measure like this would have on like our housing stock, whether it be in total or maybe localized? And then just because I normally we build that off slowly and incrementally with like TID measures, I'm just wondering, is this like a big step ahead for us in these areas?
Alder Rouse, I think the challenge, and I mean, this conversation is illuminating in some ways. So for example, the areas that we're looking at putting these houses are areas where TIDs probably wouldn't produce much increment at all. TIDs wouldn't be very effective tools there because they're in neighborhoods where there's not a lot of increased valuation in some of the housing. And so I think the question for all of it, just to try to answer your question and echo what President Tate said, look, if there was money to be made here doing houses this way, I think the private sector would be in there doing it. I think what we've been doing with CDBG funds a little bit at a time, and now with a larger extent, thanks to Joe Biden, the American Rescue Plan Act, sending these funds to cities like Racine, is we're able to make investments not just in neighborhoods where the values of the houses are growing and where private development wants to occur. We're also able to do it in every neighborhood. And so that investment obviously has a fiscal impact because there's now additional houses in that neighborhood that will set a new comparable sale at a higher level. But it also is in a neighborhood where we know it will be some time before that's the norm and not the exception in terms of valuation. But it also creates more options for home ownership, which we've stated is a goal for us. And it says that we're investing everywhere in our community and not just certain neighborhoods. I'll ask Mr. Redjick if he wants to add more context in terms of what those specific home values will do in that neighborhood. Again, it's not nothing, but it is limited in what it can accomplish. Mr. Redjick?
Thanks, Mayor, and thank you, Alder Rouse. But Mayor, I think you summarized it very well. Adding comparable sales is a very important. It's very important step from an appraisal perspective for the values of of housing stock throughout certain neighborhoods that may not have comparable sales for the types of housing that we would be building. So I think that it definitely helps to bolster and support and stabilize property values in areas where, as the mayor said, they may not warrant, even the creation of a TID, just because, we wouldn't be able to necessarily, the property values, may not be stable enough to warrant that. This helps to act as a stabilizing factor and get values going, in the right direction to benefit other property owners and other homeowners in those neighborhoods. So it absolutely has neighborhood-wide and community-wide impacts that are positive.
Awesome. Thank you very much.
Thank you, Alder Rouse. Alder Perez, did you have additional questions or comments?
Yes, sir. Since I have been personally attacked, I'd just like to say that I know that iron sharpens iron, and I welcome all the debate, and the comments have been very interesting, and I don't take any offense to this. I appreciate our system. I appreciate our debate system. So do what you can, and thankfully we can vote the way we can. And that's what's great about our process. We may not always agree, but we have the ultimate goal to make this a better community. And there's different ways to come about it, and we can do it working with each other. And sometimes, like I said, there's 15 of us that have to make these hard calls. So we make them. And I appreciate all you guys, in spite of what you may think. Thank you. Bye.
Thank you, Alder Perez. Alder Pete.
Thanks again, Mr. Mayor. I just kind of want to reiterate comments I made earlier. And I'll use by an economic term called an economic multiplier. Dollars spent in any community has a multiplier effect, meaning whether it's a small business, improving home values, the social improvement, other people see this house, they want to build it. And being one of the, let's just say, people over 30 on the council, I can name multiple neighborhoods and areas where both public and private sectors have developed partnerships, not too far from where I'm sitting, just west of West Boulevard is a great example. The majority of that was private funds. I knew the developer, but the point is it did. And I'll use a quote that some of you may not like for me to use, but sometimes a rising tide does cause all boats to rise. Thank you.
Thank you, Alder Pete. Any further discussion on this item? Seeing no further discussion on this item, again, what we have before us is item 111-22, communication sponsored by Mayor Mason requesting the city transfer 233 Jones Street, 1801 Mead Street, 1805 Mead Street, 1422 Marquette Street, 1317 Albert Street, and 1637 Packard Avenue to the City of Racine Community Development Authority for the purpose of redevelopment and sale to homeowners. When the clerk calls your name, please vote as you wish.
Alder McCarthy,
Aye.
Alder Toe,
Absolutely, yes.
Alder Jones,
Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Caprillion,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder West,
Aye.
Alder Pete,
Aye.
Alder Rouse,
Aye.
Alder Perez,
No.
Alder Taft,
Aye.
Alder Mikma,
Aye.
Alder Lemke.
I'll go with Alder Coes. Absolutely, yes.
14 ayes, 1 no.
All right. Just as a point of clarification, adjectives do not weigh the votes any heavier than ones without adjectives, but I appreciate the enthusiasm. Alder Taft, if you could continue your report prior to going into the next two, these are both noticed for closed session. If you could read the appropriate language.
I'm sorry, before we do so, this is
Oh,
Alder
sure.
Caprillion.
Yeah, Alder Caprillion.
Thank you so much. There was just one item that I did not want for separate consideration, but I just had a question on it.
Okay, can you state the item?
Yeah, absolutely. It is the item number 0081-22.
If you could state your question.
Okay. I happened to notice that the grant deadline was February 18th, and I'm just wondering if we got an extension, as today is March 1st, for us to be able to vote in that, be able to move forward.
I will defer your question to the Chief of Police, who I believe is on the line.
Yes, I'm trying to get my video to start. It won't start, but the answer is we erred on the side of caution and we decided we to ask for forgiveness rather than permission. So we have indeed applied for this grant. We met the deadline.
Thank you.
Any further discussion on that item? Okay, then back to Chair Taft of the Finance and Personnel Committee. The two items we have remaining for separate consideration are noticed to go into closed session. Could you please read the statutory language to facilitate that process?
Yes. All right. So the Common Council may convene in closed session pursuant to Wisconsin statutes 19.851G to confer with legal counsel concerning strategy with respect to litigation in which the city of Racine is involved. Should I read the items now or when we come out of closed session?
They are noticed. I mean, Attorney Letney, correct me if I'm otherwise, but I don't believe we need to read the items before we go into closed session, but we do need to
move to closed session. Move to enter closed session.
Move to go into close as a motion to go into closed session.
Second.
As stated, seconded by Alder Coe. Again, this does require a roll call vote. When the clerk calls your name, please vote as you wish.
Alder McCarthy,
Aye.
Alder Coe,
Aye.
Alder Jones,
Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Caprillion,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder West,
Aye.
Alder Pete,
Aye.
Alder Rouse,
Aye.
Alder Perez,
Aye.
Alder Taft,
Aye.
Alder Mikma,
Aye.
Alder Lemke.
Aye.
15 ayes, 0 noes.
Okay, we are now in closed session, so I need to ask the clerk's office to pause the Facebook broadcast.